Your call has been forwarded to an automatic voice message system.
Hannah Shaw
Is not available. At the tone, please record your message.
Hi, it's Emily from Portland. My vet says we need to run a few tests, including a blood test, before my dog's dental cleaning. Is this really necessary?
You're listening to Not Just Fluff, Pet Wellness from Banfield Pet Hospital, hosted by me, Hannah Shaw, animal advocate, otherwise known as the Kitten Lady. If you're like me, you love your animals a lot, but they can't talk, and it can be tough to know what they really need. Not Just Fluff is here to provide you with actionable tips and science-backed advice from reputable professionals who really understand pet care. If you're an animal lover like I am, there's nothing you wouldn't do to give your cat or dog the best life ever. And that means occasionally making that trip to the veterinarian. But navigating veterinary care can be pretty confusing. How do you know which vet to choose, which lab work to run, or how to prepare your animals so they have a positive experience? For me personally, establishing a great working relationship with a veterinary team has made such a huge difference in the well-being of my animal friends. So today's episode is all about developing that positive relationship with your veterinary team. To talk about this, I'm joined by Dr. LaToiya Templeton, DVM. Before graduating from veterinary school at Ohio State University, Dr. LaToiya Templeton was a middle school math teacher in Houston, Texas. Today, she's a veterinarian and area chief of staff at Banfield Pet Hospital in Garner, North Carolina. She's also a volunteer surgeon with Operation Catnip in Raleigh and is passionate about building a more inclusive, accessible future for Black veterinary professionals. Welcome to the show, LaToiya.
I'm so happy to be here. Thanks for having me.
Thank you. I would love if you could just start by talking to me a bit about what inspired you to be a veterinarian.
Gosh, this is the most commonly asked question. And I think there's such a standard answer for veterinarians in general. So for me, we grew up on the south side of Chicago. There were no veterinarians that I was able to see that really looked like me, but I knew I loved animals. So the biggest thing was making smart choices, staying focused, and going to all the schooling that it took to become a veterinarian. And I think it's just, you love them, but the more you learn, it's not as easy as it looks. So I like a challenge, and it worked out. I love my job.
That is awesome. I love staying the path and sticking to what you want to do. And I would love to hear maybe if there's a story of one animal in particular who has really touched you over the years.
Gosh, there's so many. I think one of the ones that really stand out was I originally met this client with just her one dog. I'm very personable. I really love to spend time with the clients and talk to them face to face. She had a blue pitty and she loved him, would do anything for him, but she was very clear on her limits as far as what she could afford. And I think for her, the biggest thing is not feeling bad for what she couldn't do. And so typical pitty, he's overweight. He wasn't on joint supplements. So really things that she could control. We worked, instead of him coming twice a year, probably came once every 2 to 3 weeks. And we do a weight check. I do a joint exam and we talk. What did he eat this week? How was it? How did it go? Did great. He got an excellent body condition. But I think it was just the time invested in getting over the barrier of what she felt that maybe we didn't really understand we were communicating. And it just built such a relationship that she feels good. They want to do what's best for their pet. That's our middle ground. That's our mutuality. So we just got to figure out how to do that.
Yeah. Oh, I love that story. I do animal rescue. So my relationship with veterinarians is everything to me. Having that really strong relationship between you, the animal, and the veterinarian is magical, right? So I would love if you could share for people who maybe did just get their first cat, their first dog, how should they go about looking for that veterinarian that they're going to be building a relationship with?
I think the biggest thing a client needs to look for is, do you feel comfortable? Right? Because the biggest thing is everything isn't in room anymore. Some is, but if your dog is sick, but you got to go to work, do you feel like we care for your pet as much as you do? Did you feel comfortable asking us to repeat our recommendations? Did you understand what we said? Do you feel comfortable telling me you didn't understand? Because that matters, right? When we start getting into the happy visits, that's great, but puppies grow up, kittens grow up, and they need surgery or they get sick. And so you feel like you can trust us and you're okay with questions. That's the biggest thing. If you do a veterinary visit and you don't feel like you really understood anything or you can't take one or two pearls of wisdom home, I don't think that that's the right fit for you for the lifetime of that pet.
I love the thought of that relationship building, and you're starting with this puppy or kitten, but you want to have that relationship that grows over the years.
Absolutely.
It was very scary for me a few years ago. I moved from the East Coast to the West Coast, and the thing that I was the saddest to lose was the vet hospital that I went to. I cried saying goodbye to them because I was there all the time. I knew them so well, and I was like, they're not going to know me in California. I'm going to have to start over a new relationship.
Yep.
So what are the questions that you would recommend people ask if they're starting a new relationship with a vet?
Absolutely. So I would argue be your most authentic self. So that way I can make sure I'm meeting your needs where they are. So for me, did I come out and say hello? Can you recognize me from a lineup? If you have a puppy, right? What kind of food should he be on? What's his ideal weight as he grows up? Should he be on joint supplements? Is he allowed to go outside? If you have a kitten, I have another cat in the house. Little things make a difference. What kind of toys is okay for them to play with? Are they on heartworm prevention? One of the things I love about Banfield from last year and this year is our focus on heartworm prevention. Every pet, every time, what kind of prevention are they on? And if you can't pill your animal, it's okay. We have shots or we have topical therapy, but it's critical. And I want to make sure that you guys, the clients, feel is as critical as we do as veterinarians because it makes a difference in their overall health.
Yeah, you keep bringing up asking questions, and I think that is really important. I think it can be intimidating for someone. They've never been to the vet. They feel like, oh, I don't know what I'm talking about. I don't want to seem stupid, but there are no stupid questions when we're caring for our animals.
So you feel intimidated, like I've got this license, I've been to medical school. No, this is your dog, right? I want to make sure I'm meeting your needs. Like I'm interviewing for you because you're going to do all the legwork at home. So I want to make sure when you come to see me, you're telling me the truth and we're able to fix the problem because otherwise we're going to miss each other. And that's really not the goal. So ask questions and make sure you feel comfortable with the answers.
Sure. Yeah, that's a big one for me with veterinarians. I like a veterinarian who I can say, I don't really even understand this part of their anatomy. Can you draw me a chart of what the heck a liver even does? Can you just draw it for me? And I have veterinarians who will be like, okay, here's how it works. And then I look at it and I go, okay, I'm leaving educated. And as the person, like you say, the veterinarian is setting the treatment plan, but ultimately the client is the one who has to do it. So if you don't understand what you're doing, it's very important to have that relationship. So a big issue I see in cat and dog welfare is people think you don't need to go to the vet until the animal is super sick. What would you say to people who have that mindset? They're like, I don't need to start a relationship with a vet right now because my cat or dog seems completely fine. When should they be coming to the vet and why is it so important?
I think preventive care saves lives every day. So I would argue that point to say there are some zoonotic diseases that your pet could be prevented from. For those who don't know, zoonotic means it's possible for humans to catch it. So with your pet not being vaccinated or even dewormed from simple intestinal parasites, if you or your kids or anyone who have a compromised immune system get infected or the disease is transmitted, you look at that from a one health issue that easily could be prevented, just like we take our kids to get shots, boosters, immunizations. It's just as important for your pet. And for those who may not see it that way, you definitely have self-preservation. So at the very least, protect yourself by keeping your pet with preventive care. And those are things that we teach you and tell you from the first visit to the last one. And then you pass that down to every other pet. And
yeah, I'm absolutely with you. So can you talk a bit more about that? When you're doing preventive care with cats and dogs, what are you recommending that people do each year?
So it depends. So if you have a puppy or a kitten, I'm recommending serial vaccinations or immunizations based on their lifestyles. Some are required by law and some are just really good. And then some are zoonotically required or recommended, and those guys are younger. So you're probably going to do maybe blood work once, right? If they're getting sterilized. Whereas if you have a 9-year-old dog, I might be recommending the same vaccinations, not as frequently, but I'm recommending a senior dog food and joint supplements. And if I hear a murmur, we should probably start talking about ways to slow down the changes of their heart. Typically, what we're seeing a lot right now in veterinary medicine is liver issues. Mild, but clients had no idea. So putting them on supplements, things that you would not know by looking at your dog that their liver or kidney are changing, which is why blood work is more recommended as they start to get older. We may not do it once a year. Now we're probably doing it every 6 months to a year based on their minute changes that you would have never known, but we can get ahead of it and to make sure they're as healthy as can be.
So you mentioned that animals' care changes across the course of their lifetime. Can you talk a bit about how often people should be picturing taking their animal to the vet depending on their age?
Yeah, so puppies, just like our children when they're first born, they come to see veterinarians a lot because they need booster shots. They do not have a complete immune system. And so we booster certain vaccinations until a certain age where then it's not nearly as frequent. So for most puppies, we're going to see them once a month. Whereas if you have an adult dog that's otherwise young and healthy, twice a year. As long as their checkups are going great, you've done blood work once a year just to make sure everything's okay, because there are some congenital things that could be going on the inside that blood work would help you catch. And then as your dog is older, you look at 8 and 9 years old, we consider them in the senior stage of life. They sometimes can stay every 6 months as long as they're otherwise healthy. And then as we start to find things, we might ask them to come once every 3 months or as needed based on their individual situation. And I think that's one of the beauties of Banfield's wellness plans because you're guaranteed every 6 months. But then you also have the unlimited office visits where when things change or something else comes up, you can come see us as much as you need to. And we're happy to recheck things and make sure, again, you understand the course of action we're doing because we'll need to make changes based on how they're responding.
Sure, that makes a lot of sense. Yeah, I think it can be surprising to some people. I foster neonatal kittens and puppies. So when I'm doing adoptions, people can be surprised sometimes when I say, okay, are they up to date on their vaccines? Yes. And you also are going to be continuing that now, and you're going to be going and establishing that relationship with the vet. And they're like, oh my gosh, how many do they need? But it's very important to take that
It's
seriously.
intense. That first 4 to 6 months, it is a lot of visits that you may not have otherwise thought about.
Sure. Yeah. But it is very important. And I love it because I don't want it to be that they're done getting their veterinary care with me. I love being able to say, here they are. And now in the next 2 to 3 weeks, you want to take them and establish your new relationship with your vet. Yeah. So you mentioned blood work, and we actually had a caller who was asking about lab work. They said that they were recommended lab work before a dental cleaning, and they wanted to know, is this really necessary? So can you talk about that? Why is lab work recommended before dental, and what can it show?
So when you think of, again, I try to correlate with a lot of clients on human and animal medicine. A lot of what we approach with our profession is similar to human medicine. Again, in that one health idea, before a doctor puts us under anesthesia, we do blood work. And the biggest thing for that is what are the changes we're seeing? And can this pet safely tolerate anesthesia? There are some anesthetic drugs metabolized or processed through the liver or through the kidney. But if I do pre-anesthetic blood work and I see your organs are compromised or you have a significant infection, right? Your white blood cell count is through the roof. I then have to decide, is this an elective procedure that I can come back to once we address what's going on? Because last year you may have been perfectly fine, but this year something has changed. And so anesthesia has inherent risks just because it's anesthesia, right? We do everything we can to make sure every pet comes out and they recover well. But there are some that are what we call increased risk. And you really have to debate and be honest with clients, is this procedure absolutely worth the risk? And then we partner together on talking through the pros and cons of that choice. But there are things you would not find without the blood work before you put them under anesthesia.
Yeah, with my own animals, there's like nothing that I would not do for them to have the best experience possible. So I feel like I get so much lab work done on my animals. And what's interesting about cats and dogs is they can't talk, they can't tell us what's going on. And sometimes they can really hide signs of illness that aren't even apparent on site, but that are apparent through diagnostics and lab work. Can you talk about some of the other lab work people might be asked to do at a veterinarian's office? Like, maybe urinalysis, radiographs, like what
Exactly.
is all this stuff?
Right? So some of it we try to do with anesthesia. If you're going to do x-rays when they're sedated, it's the best time because you're going to get quality images. The dog isn't moving, they're not fighting you, and they're really comfortable because they're still in their happy place, right? So you get what you need. But there are some instances where, like a common misconception with clients is ear infections, right? I just want the doctor to look at it and give me the same thing I had last time. But the funny thing is, just looking at something does not always tell me what is it, right? So if a dog has an ear infection and it smells like corn chips, you think yeast, he's had it forever. But one of the crazy things is you don't always smell rot type infections, which are actually more severe and a different medication. So without doing an ear swab to look under the microscope at the little cells that are in your ear, I might miss the rest of your infection. And then that's when we do the recheck. And sometimes it's frustrating to clients. Why is it not clearing up? Why didn't it fix it like last time? Yeah, because that would have changed my recommendations. So having the most information gives us the most likely chance of fixing the problem the first time. But medicine is an art and a science. So there are some times where you get the testing and there are more things going on. But gosh, if you have the testing, I found 10 times out of 10 that definitely saves resources for the clients. Same thing for a urinalysis, right? If they're pottying in the house and that's not normal, I surely cannot look at their pee and tell you what's in there. But that's what the microscope is for. That's what the labs are for. It helps us help you help your pet. And that's all of our goal anyway.
Sure. Yeah. It's got to feel like we have the technology. I shouldn't have to do
Yeah,
this
right?
from sight and scent alone. Banfield and the AVMA found that the vast majority of veterinary professionals and clients want to build stronger and more positive relationships. What does that mean for you? What does a positive relationship mean for you?
I think a positive relationship for me is communication, transparency, honesty, and vulnerability because sometimes, yeah, that drug did not touch this dog. Okay, here's our new plan, right? I'm so sorry you have to drive back up here. I need to add something to help keep, I don't know, Fluffy calm during his recovery period. But I think that them hearing us say those little things or just acknowledging their inconvenience, those things matter and they're small. And that builds a good relationship because you're not dismissing the inconvenience, which sometimes it can feel like we are. We have maybe 20 pets, but they just have that one, and that one is their world. For the client, it's the ability to know that we care about their pet as much as they do. Then they'll listen. If they know you, if they've seen you on the good days, you've got them on the bad days because you've already done the legwork. So I think those are big, big parts of healthy relationships. And it's certainly something I work with my 3 hospital doctors on really making sure they take the time to invest with those clients.
Yeah, I love the just humanization of this other person that you don't know, but like that you can acknowledge, like maybe the traffic was bad. Maybe this is scary and hard and sad for you. I want to say from the client side, like that's also important to me. I always tell people, like, be nice to your veterinarians because they have a very hard job. And I know that you're stressed when you go to the vet, but I try to like just show such immense gratitude I just tell people, thank you for putting in the years to know the things that you know. So a bit of gratitude, I think, from the client side goes a long way too in building that relationship.
Absolutely.
Yeah.
Right.
Well, there are a lot of different types of veterinary practices, and they all kind of have their space, right? We have our urgent care and emergency practices. We have our general practices. We have our specialists. Can you talk about what people can expect in terms of when they would be going to each of these types of practices and what role do they play?
So when I think of urgent care, I think of typically Non-dramatic issues. So if your dog has a small laceration or cut and it's not, like I said, a time where your normal practice is closed, or a raging ear infection or a UTI or smaller things. When I think of an emergency, right, this is a hit by car case. This is a foreign body that was diagnosed at 6 o'clock as the primary doctor's office was closing. Things that are going to need more advanced care or that are truly emergent, very similar to human medicine, right? Urgent care does basic urgent things. Urgent and emergent are not the same things, and they have very different definitions. And those are the reasons they do. And then when you think of a specialty hospital, that's going to be the same thing as human medicine. When you need to see someone who has advanced skill sets on a particular body system. So, general practice, we're jack of all trades, right? We can 9 times out of 10 find what is wrong. And then we should all, as doctors, which I think we do a pretty good job, is acknowledging our limitations, right? If you need an echocardiogram because there are changes in the heart that I can see on imaging and hear, Banfield can do x-rays. We don't have specialty material or imaging or even the capability to do extensive workups that your pet might need. And so we refer you to a specialist, right? Cardiology, ophthalmology, and they're wonderful. And the benefits of going to them is they are specialized to have your pet have the most concise, effective appointments and get right to what's wrong. And then they help us manage the case. So it really brings in the partnership aspect of you went to see them, they've given us the feedback, we've entered into the records, and now we can manage the case. We all win, right?
Now, something that we saw spike during the pandemic was virtual care for our pets. When is it possible to seek virtual care versus doing an in-person visit?
I think one of the most successful appointments I've seen for virtual care is behavioral based because it's really the clients talking to you. There have been a few instances where we've done virtual and the client says certain things that kind of pique your interest. Like the cat is losing a lot of weight. They're like heat seeking. It's 14. So in my mind, we should do blood work. But tell me more about the behavior, right? It's not a wasted time because they still think it's behaviorally based. But I know hyperthyroid cats change behavior. I've gotten all the information I need to help the client realize it's something else. And I think that that's the greatest benefit in both worlds. I don't see a lot of success with surgical rechecks. Sometimes the camera is fuzzy and I thought it looked fine, but it's really swollen and your angle was weird. Like those can be hit or miss. I don't love doing those. Behavioral and medical questions as far as medication, those are fantastic. You can show me your pill bottle. Like, I don't even have to guess what you're talking about. Show me your pharmacy and let's go through it. Because sometimes clients don't remember the name or how much is the milligram. So I love when clients bring out their little cabinet and they show it to me. And we talk about, yeah, put this on there so you know this is not that. Put this here. He can take this. I think it helps them stay organized, but it also helps me prevent a bigger problem down the line. Some of their questions don't need to be a visit. Some of them, they can stay in their home and we can chat. That cat that's angry, don't bring him in. Let him stay at home, curled up in his bed, scratching his post, and we can talk about his behavior on the phone. It's all good. And then everybody wins. That's much less stress for everyone involved.
You mentioned kind of animals that don't like coming into the vet. And that's actually my next question. Sometimes maybe the client loves going to the vet, but the animal doesn't love the vet as much as the vet loves the animal.
Right?
What would you recommend to help people have a better experience of bringing their cat or dog to the vet if they are not such a big fan?
I love that question. I think it's important to have a plan. So if you know your pet is highly reactive or just nervous, they might have triggers while they're waiting, right? And so you might want to schedule a time where the team is expecting you. You've called and said you're in the parking lot and they're waiting to put you right in the room. And so that might be what's best for your pet. Another thing is, what's their trigger? Is it the car ride? For cats, is it getting in the carrier? What is it? Is their carrier too small? Did you put 2 of your cats in that carrier? Because we could just buy 2 separate carriers. What is it? And then remember that drugs or sedatives help us help them. because they need to be seen if something's wrong or if it's just a checkup. But if we can't physically touch them, they were stressed for no reason because we didn't get the job accomplished. I think that there's a stigma with sedative type medications, whether it's gabapentin or trazodone. It's almost like if someone tells you your kid is bad and it feels like a bad reflection on you, right? But that's not really what we're saying. It's not going to knock them out so they're drooling everywhere and they can't stand up. It's going to take the edge off though. So maybe it doesn't take you an hour to catch them and get them in the carrier and then drive 20 minutes to us. And then it's building up, it's layering. But if we give them something to help just calm them down a little, it might be a lot easier to get them in the care. They're slower, they feel great. You can put the leash on, they're sleeping in the car ride. Things that usually were very, very reactive aren't that way anymore. And it takes time. Just like for people who have anxiety type disabilities or barriers, you don't always get it right the first time. So being gracious.
It's funny you say, they're not a bad animal. They're sensitive to it. I have one cat, my cat who has kidney disease, who is definitely like the drama king of the century when he goes to the veterinarian. But like through experience, we've figured out the things that work for him to keep him calm. And, he knows that he's going to get his little treat that he loves so much at the end of all of it. And it really is just about kind of like accepting who they are and then working within those limits.
You got to believe it, right? It's like a parent who doesn't believe their child was the one. First, it comes with acceptance, like acknowledging this is your animal and it's okay. Some animals are just who they are, and we expect this for the rest of their time with us. We will need to set up certain guardrails to keep everyone safe and to keep them safe, right? That's important too. We don't want them to hurt themselves or the staff. So figuring out what they need and what works for them. I'll tell you something that's helped me fight that uphill discussion with clients is inviting them in the room with me, right? Because there is also the idea that my dog would never do that. No. What did you guys do? Come on in. Let's try this pedicure together. Then when they see the behavior, it's a lot easier for them to go like, okay, right? Some people need to see the other side because you're thinking of the dog at home that's on the couch getting belly rubs. Yeah, that's not actually the same as expressing his anal glands, right? They're completely different temperaments for different things. And sometimes it just helps for you to see what I'm referring to. And I found that works way more than me going back and forth with the client because they want the pedicure. They want whatever needs to happen. Again, it's really coming from a place of you want the best for your dog and I want the best for your dog. It's really easy to get frustrated when you feel like clients are missing what you're trying to say, or for whatever reason, they're not listening to your recommendation. But assuming positive intent goes a long way on both sides.
I love that. Is there anything else that people can do at home in preparing for their vet appointments so that it's a successful visit?
Yeah. So if your animal is responsive, like calming type pheromones within your home, getting the carrier out 2 days before so they can get used to it. If you're always getting it out an hour before you go, again, trigger and not having enough time to respond. And a lot of us have seen benefit in loading doses of sedatives. So giving it the night before with dinner or that special treat that they love, and then doing it 2 hours before the visit, again, associated with something positive so that it's not, I need to use a pill gun or I might get bit or all the extra things. The biggest thing is going to be, what do they like? And how can we achieve this with as least amount of drama as possible?
Mm-hmm. Well, thank you so much for all of that great information.
Banfield's here to provide you and your pet with smart, affordable, high-quality pet care, so you can worry less about the vet and wellness stuff and instead enjoy life with your BFF. That's why we created Optimum Wellness Plans. Our plans aren't insurance. They're year-long bundles of preventive care custom-built for the pet you love. Plans include unlimited in-office visits, 24/7 chat for general pet health advice, virtual vet visits, vaccines, dental cleanings, discounts, and more. Optimum Wellness Plans. Essential pet care made easy. Learn more by clicking the link in the show notes or visit us at banfield.com.
So now we're going to do some fast facts. My first fast fact is that a 2020 study by the American Association of Feline Practitioners found that fewer than 48% of cats receive regular veterinary care. That was a really, really sad one for me. They found that 51% of people with cats think that they are low maintenance animals, and that 75% of them don't believe that cats hide their symptoms. As a cat person myself, I can see how cats are masterful at hiding their pain. So I wanted to share that fast fact to say, hey, if you're one of these people listening going, my cat's not in pain, my cat doesn't have illness, they don't need to go to the vet, they actually really do. They need to go in for those wellness visits.
That's a very low percentage.
I know. It is very sad. Come on, cat people. We got to do better than that. We got to get our cats in for those wellness visits.
So a fast fact I have is it takes 8 years to become a veterinarian. You have to do 4 years of undergrad, then 4 years of veterinary school, provided you don't choose to specialize, which could add anywhere up to 2 to 3 years before you're actually practicing in that specialty. It's a commitment.
That's amazing. Well, what an important commitment it is. My second fast fact is about microchips. I am a huge fan of microchips, but this was something that I didn't know until I was reading about it the other day, that the concept of pet microchips originated only in the 1980s. And it was an idea by a Nobel Prize winning scientist who thought that maybe we could use RFID technology for identifying lost animals. So since then, there's obviously been millions of animals who have been microchipped, and it is something that I am a huge fan of. I recommend people talk to their veterinarian about getting them microchipped, and of course, keeping that information up to date on your microchip.
That part
is
very crucial. Yes.
Yeah. I try to tell people a microchip is like either an incredible piece of technology or it's like a useless grain of rice, because if it is not registered and you're not keeping it up to date, it's of no use. But keep that up to date, and it's pretty amazing piece of technology.
Accurate. So a fast fact I have is veterinarians, we are the most under diverse profession in all the healthcare professionals. It is a shocking amount of veterinarians where there are less than 2% of veterinarians that are African American, and the numbers go down from there. So definitely it is a huge, huge difference in when you look at human medicine or even farmers. I just learned this last week. Farmers are a more diverse profession than veterinarians, which just really goes to show you that we're making strides in so many areas, but there is so much more work to be done every day. There's 32 vet schools in the entire country, which is a super small number. And all of us and all of them needs to focus on the goal of diversifying this profession for a better promise for pets.
That is a shocking number. I had no idea, less than 2%. Oh my gosh. But it goes back to what you were saying in the beginning of the importance of finding people when there are animal lovers in a community looking for professionals who can help them, who look like them, who are from their community. I think that is incredibly important.
Makes sense. Exactly.
Yeah, it's incredibly important. So thank you for sharing that. Well, I have learned so much from talking with you. I wish we could talk forever. I love this conversation, and I really appreciate you for helping shine a light on the relationship between veterinarians and clients and their animals.
I love it. Thank you so much for your time.
This was such a great conversation, and I hope it's helped you feel inspired as a caregiver to seek the veterinary support and ask the questions so that your animal friends have what they need and deserve. I've always felt that animals, animal lovers, and veterinarians make a very amazing team, and when we work together, we can really make magic happen. Thanks so much for being an advocate for your animals at home, and thanks for listening. Thank you for listening to Not Just Fluff, pet wellness from the pros at Banfield Pet Hospital. Make sure to get your paws on the like and subscribe buttons so you don't miss an episode.